What is the difference between familial hyperlipidemia and hypercholesterolemia? Have you ever wondered why some people have high cholesterol levels from a young age while others develop it later in life? Today, we will clarify the difference between familial hyperlipidemia and hypercholesterolemia. Familial hyperlipidemia is a genetic condition that runs in families. It leads to very high levels of lipids, especially low-density lipoprotein cholesterol, from birth. This happens due to mutations that affect how the body clears low-density lipoprotein cholesterol from the bloodstream. As a result, individuals with this condition can face severe elevations that may lead to early heart disease and heart attacks. Familial hyperlipidemia is inherited in an autosomal dominant pattern. This means that if one parent carries the defective gene, there is a 50% chance that the child will inherit it. There are two main forms of this condition. The heterozygous form is more common and less severe, while the homozygous form is rare and leads to extremely high low-density lipoprotein levels, often resulting in cardiovascular disease in childhood. Physical signs of familial hyperlipidemia can include cholesterol deposits in the skin and tendons, known as xanthomas, and yellowish patches around the eyes, called xanthelasmas. Diagnosis typically involves finding very high low-density lipoprotein cholesterol levels that do not improve with diet or exercise, along with a family history of early heart disease. On the other hand, hypercholesterolemia is a broader term that refers to high cholesterol levels in the blood, particularly elevated low-density lipoprotein cholesterol, regardless of the cause. This condition can arise from genetic factors, lifestyle choices like diet and lack of exercise, or other medical conditions. Unlike familial hyperlipidemia, hypercholesterolemia is not always inherited and can develop later in life. Hypercholesterolemia includes both inherited and acquired causes of high cholesterol. While it increases the risk of atherosclerosis and cardiovascular disease, it may not show the physical signs seen in familial hyperlipidemia. Often, hypercholesterolemia can respond well to lifestyle changes and medications. In summary, familial hyperlipidemia is a specific inherited disorder that causes very high low-density lipoprotein cholesterol from birth, often with visible signs and early cardiovascular risk. Hypercholesterolemia is a general term for elevated cholesterol levels from any cause, which may appear later in life. Understanding these differences is important for effective management and prevention strategies.